lateral pterygoid muscle. The lateral pterygoid muscle has two heads or bellies. The inferior belly is 3 times larger than the superior belly, and among all the masticatory muscles, it is the only one with horizontally arranged fibers, the lateral pterygoid muscle. The lateral pterygoid is a craniomandibular muscle that plays a crucial role in the inferior temporal region. It is active during mastication and mandibular movements, including protrusion, which is forward movement of the mandible, abduction, which is depression of the mandible, mediotrusion, which is the mandibular condyle movement towards the midline. And it works particularly during speaking, singing, and clenching. Functionally, the muscle is analogous to the temporalis muscle. The fan-shaped temporalis muscle exhibits a continuous range of anteroposterior movements, while the lateral pterygoid muscle exhibits a range of mediolateral and superoinferior movements. The lateral pterygoid is a single unit divided into two bellies with clear identified anterior insertions and posterior attachments that remain controversial. The two bellies of the muscle separate thanks to the different convergence of the muscle fibers, and the lateral pterygoid is a short muscle with a triangular pyramid shape and an uppermost base. The superior belly, also known as the sphenoid head, inserts anteriorly on the infratemporal surface of the greater wing of sphenoid. I repeat, on the infratemporal surface of the greater wing of sphenoid and the superior quarter of the pterygoid process's lateral wing. Its posterior attachment has been widely debated, but it is believed to insert on the disc and mandibular condyle, the anteromedial border and medial aspect of the disc and mandibular condyle, the anterior part of the neck of the mandibular condyle. All authors have agreed that some fibers of the superior belly attach to the articular disc as well. The inferior belly, also known as the pterygoid head, is 3 times larger than the superior belly and anteriorly attaches on the inferior two-thirds of the lateral area of the pterygoid process's lateral wing, the inferior two-thirds of the lateral area of the pterygoid process's lateral wing, the lateral area of the pyramidal process, and part of the maxillary bone tuberosity. Its posterior attachment corresponds to the pterygoid fossa of the neck of the mandibular condyle and the TMJ capsule. Again, the lateral pterygoid is a short two-headed muscle located in the infratemporal fossa, and the smaller superior head arises from the infratemporal crest of the greater wing of sphenoid, while the larger inferior head arises from the lateral surface of the lateral pterygoid plate. The fibers of both muscle heads merge and insert on the pterygoid foveae on the neck of the mandible. Some fibers from the superior head insert on the capsule of the temporomandibular joint and the articular disc.
The lateral pterygoid muscle has two heads which lie almost horizontally to each other. The small superior head runs from the infratemporal crest of the sphenoid to the articular disc of the temporomandibular joint. The much larger inferior head courses from the pterygoid process of sphenoid to the condylar process of mandible. Due to its anatomy, palpation of the lateral pterygoid is quite difficult. This muscle is innervated by a nerve with the same name, the lateral pterygoid nerve, which branches out from the mandibular nerve. The pterygoid muscles are muscles of mastication.
On the lateral side, relationships the lateral pterygoid muscle relates to the mandibular ramus, maxillary artery, temporalis tendon, and the masseter muscle. And on the deep medial side, the muscle is related to the mandibular nerve, the middle meningeal artery, the sphenomandibular ligament, and the upper part of the medial pterygoid muscle. Deep temporal and masseteric nerves and vessels emerge from the upper border of the superior belly. The lingual and inferior alveolar nerve and vessels pass beneath the lower edge of the inferior belly, and the second part of the maxillary artery runs between the two bellies to enter the pterygomaxillary fissure. The buccal nerve and respective blood vessels traverse the two bellies of the lateral pterygoid muscle mediolaterally. The inferior belly was classically described to function in depressing, protruding, and deviating the mandible to the contralateral side. The superior belly was mostly believed to become active during the elevation of the mandible to close the mouth. However, the superior belly may have little role in closing the mouth and may become active during mouth opening, protrusion, and contralateral deviation, just like the inferior belly. The lateral pterygoid muscle depresses the mandible and opens the mouth when assisted by the anterior belly of digastric muscle and the mylohyoid muscles. Among all the four muscles of mastication, namely medial pterygoid, lateral pterygoid, masseter, and temporalis, the lateral pterygoid is the only muscle that participates in depressing the mandible. The unilateral contraction of the lateral pterygoid muscle with the ipsilateral medial pterygoid results in lateral mandibular movement to the contralateral side. This movement is observable during functional and parafunctional lateral excursive movements, that is, during chewing, stroke, mastication, and clenching. When both bellies of the lateral pterygoid muscle contract bilaterally, the mandible travels anteriorly, namely protrusion. Now, unlike the jaw closing muscles, this jaw depressor does not contain muscle spindles. Due to the absence of muscle spindles, the lateral pterygoid muscle plays a secondary role during mandibular depression. Muscle spindles that are stretch receptors are required to detect any change in the working length and velocity of the muscle. During functional movements, this prevents excessive muscle stretching. The lateral pterygoid muscle plays a crucial role in controlling the function of the jaw and temporomandibular joint. It also appears to function during the generation of horizontal forces required during mastication and parafunctional activities. And there have been suggestions that some fibers of the superior head of the lateral pterygoid become active during clenching. This prevents the mandibular condyle from being displaced posteriorly, thus avoiding the exertion of pressure on the sensitive postcondylar structures. Nerves. The lateral pterygoid receives innervation from the mandibular branch of the trigeminal nerve. The main trunk of the mandibular nerve divides into an anterior and a posterior division. The anterior division gives off three motor branches. One of the motor branches is the nerve to the lateral pterygoid, a paired nerve, one for each belly, innervating the lateral pterygoids. Now, according to some authors, this muscle may also receive innervation from the anterior, middle, and posterior deep temporal nerves, masseteric nerve, and sometimes from the buccal nerve. They innervate different muscle parts, resulting in selective activation, which ensures coordination of movements and reduces stress on the temporomandibular joint. It is generally accepted that the lateral pterygoid is innervated by the lateral pterygoid nerve, which arises from the mandibular nerve. And although both bellies receive the innervation from the mandibular nerve, different nerves may innervate each one of them. Kim described a typical nerve distribution pattern where the superior belly is innervated by the buccal nerve and the inferior belly by the mandibular nerve trunk. Surgical considerations. The lateral pterygoid muscle is located deep in the infratemporal fossa. The inaccessibility of this region and its surrounding tissue makes the anatomical dissection of the muscle a challenging task. Significance. The spasm of the lateral pterygoid muscle can be painful and result in trismus, also called locked jaw, and the patient may require analgesics or muscle relaxants. Some authors believe that during temporomandibular disorders, this muscle plays an important role. This involvement may be due to the absence of coordination between the muscles' superior and inferior bellies. This lack of coordination leads to disturbance in the horizontal positioning of the intra-articular disc relative to the condyle. Clinical examination of patients with such disorders reveal pain in this muscle region during jaw movements and with palpation behind the tuberosity region. In the internal derangement of the pterygomandibular joint, there are implications that the superior belly of the lateral pterygoid plays a role in causing anterior dislocation of the disc. The prolonged contraction of the muscle places forward traction on the disc, resulting in anterior displacement of the disc. Clinical significance in prosthodontics. Long-term, completely edentulous patients wearing dentures with worn-out occlusal surface of the artificial teeth tend to position their mandible in the forward and lateral position. The dentist may notice different anteroposterior lateral teeth contact positions during subsequent appointments, which poses difficulty in fabricating a new complete denture, particularly during the recording of the maxillomandibular relations. There have been suggestions that this variation in the position of the mandible during resting jaw posture is a result of an attempt to attain a reasonable bite with worn-out dentures. Some authors believe that the lateral pterygoid muscles' lower and upper belly plays a significant role in maintaining the mandible at this new anterior position. The variations in the activity level between the two bellies on each side determine the lateral and anterior posterior positioning of the jaw. The origin of both the bellies of the lateral pterygoid muscle is medial to their insertions. Thus, the wide opening of the mandible may temporarily result in the mandible undergoing distortion in the transverse plane. And therefore, during impression making of the lower arch, if the mouth is widely open, it may result in an impression that is not accurate in the transverse dimension due to mandibular flexion. Other issues. Some parafunctional movements of the jaw are characterized by protrusion and side-to-side movements of the mandible. Such actions are associated with large jaw-closing muscle activity, necessitating sizable horizontal force vectors to overcome the frictional resistance between the teeth. The inferior belly of the lateral pterygoid muscle and the superior belly play a vital role in generating these horizontal forces. And herein we have had a comprehensive overview of the lateral pterygoid muscle.